Most women with cystic fibrosis who are in good health have positive pregnancies and outcomes. In the past decade, medications have become available that treat the cause of cystic fibrosis and are dramatically improving lung function as well as quality and length of life. As a result, more women with cystic fibrosis are becoming pregnant. Managing cystic fibrosis during pregnancy is crucial because women can be at increased risk of complications if their cystic fibrosis is not well managed. In this short video, we'll explain how cystic fibrosis can affect your pregnancy, how your pregnancy can affect your cystic fibrosis, and how you should continue to manage your cystic fibrosis during pregnancy. The information in this video is general, and all women with cystic fibrosis are advised to seek individual pre-pregnancy advice from their specialist team. How could cystic fibrosis affect my pregnancy? In the past, infertility was relatively common in women with cystic fibrosis, but with the introduction of new treatments, fertility rates have increased enormously. It's important to consider genetic testing for your partner, known as carrier screening, before you become pregnant. Because you have cystic fibrosis, your baby will be a carrier of the cystic fibrosis gene. But if your partner is a carrier themselves, there's a 50% chance your baby will be born with cystic fibrosis. Your specialist team will discuss the likelihood of your baby being born with cystic fibrosis with you during your pregnancy. Women with cystic fibrosis in good health have less risk of pregnancy complications than those in poor health, so it is important to use your medications as advised by your specialist cystic fibrosis team. Your BMI is also a good indicator of your health, and women with a BMI of between 22 and 25 are less likely to experience complications in their pregnancy. Your midwife and specialist team can support you with leading a healthy lifestyle during and beyond pregnancy. Women with cystic fibrosis have a higher chance of having their baby early, that is prematurely, or having a small baby, and these risks increase with the severity of cystic fibrosis. A breathing test, known as an FEV1, of less than 50% is associated with an increased risk of these complications. Your specialist cystic fibrosis team will discuss your results with you and advise on how to reduce the chance of or manage complications. Diabetes in pregnancy is more common in women with CF, and you are likely to be advised to take a continuous blood glucose monitoring test in pregnancy to test for this. Most women with CF deliver vaginally, and it is preferable not to perform a caesarean section unless this is needed, as it can make chest physio more difficult. Your midwife and obstetrician will discuss your birth options with you to support you to have a safe and positive birth experience. How could my pregnancy affect my cystic fibrosis? You should discuss your pregnancy plans with your cystic fibrosis specialist as early as possible so that an evaluation of your cystic fibrosis can be carried out before you become pregnant. Pregnancy is not thought to affect the long-term prognosis for your cystic fibrosis, but women with very reduced lung function are advised not to become pregnant due to the risks involved for them and their baby. Pregnancy changes the space in your chest, so you have less ability to successfully cope with the effect of chest infections or worsening lung function. Your specialist team will discuss the likely effects of pregnancy on your cystic fibrosis with you. What should I do differently during pregnancy? You should notify your CF specialist as soon as you become pregnant. They will review your medications and supplements and make any changes necessary. Any chest infections will be treated the same as for non-pregnant women with cystic fibrosis. All pregnant women are advised to take 400 micrograms of folic acid from 3 months before conception to reduce the risk of spinal problems. This is widely available from chemists and supermarkets. If you already have diabetes as a result of CF, you will need to take a 5 mg dose of folic acid, which is only available on prescription. What should I do about my medications? You should continue your inhaled mucolytics, hypertonic saline, and antibiotics. These will not affect your baby and are needed for your continued health. You should also continue to take your Creon and vitamins A, D, E, and K with a maximum dose of 10,000 international units of vitamin A per day to avoid harming your baby. Azithromycin can also be continued as the benefits to your health outweigh any potential risks. There is very limited information about the CFTR modulators as they are so new. However, the impact they make on improving health in women with cystic fibrosis is huge, so continuation during pregnancy is supported as it is thought that the benefits outweigh the risks. Your specialist cystic fibrosis team will discuss your medications with you and advise you on any changes during pregnancy. What should I expect during my pregnancy? You'll be looked after in pregnancy by midwives, your cystic fibrosis team, and a consultant obstetrician. The consultant obstetrician will see you in early pregnancy, discuss your risks and medications, and make a plan with you for your care during pregnancy and delivery. You should expect regular scans of your baby's growth. If you have symptoms and signs of a chest infection, your cystic fibrosis specialist will give you a course of antibiotics, and you may need admission to the hospital. You should expect to stay in the hospital for a few days after birth to closely monitor your recovery and ensure that you have any follow-up arranged for when you go home. You are also likely to receive chest physiotherapy. When should I seek help? If your cystic fibrosis symptoms change or you have any concerns, you should contact your cystic fibrosis specialist team. If you have any concerns about your pregnancy, you should contact your midwife or local maternity hospital. And if you feel unwell, you should call 111. To recap, you should talk to your cystic fibrosis specialist if you're thinking about trying to become pregnant, and let them know as soon as you become pregnant. Continuing to manage your cystic fibrosis during pregnancy is crucial for a healthy pregnancy. Your partner should be tested to see if they carry the cystic fibrosis gene. You should continue to take all your medications as advised by your specialist team. If you are ever worried or have any questions or concerns, contact your midwife. Thank you for watching. This educational video was created by the Southwest Maternal Medicine Network.